So, Nana, I think that legally there will be some challenges trying to hold some of these facilities liable. The challenge is that this is not a case of medical negligence, where you will say the doctors fail to act in a particular manner. If it is truly established that the facility was full, beyond capacity, and they are unable to do anything, it will be difficult for you to hold the facility strictly liable for any negligence or act that will that caused the death of the gentleman. It's very unfortunate, and my heart goes out to the family of the gentleman. I mean, it's very unfortunate that we should lose such a young person in this circumstance. What we need, over time, we have called for increase in facilities, increase in health infrastructure, which we have seen some increase. I mean, the last 10 to 15 years, we've seen a lot of new facilities being put up. We've seen what has happened to former Rich Hospital, which is now the Accra Regional Hospital. I mean, from a bed capacity of 200 to 420, thanks to the John Mahama administration for what they have done, of course, and thanks to what he did at University of Ghana Medical School, which took the NPP several months and years, including demonstration. You did that. We took demonstrations and interventions before it was made operational. And of course, we've seen the increase. But we are saying that, just as my brother Larry said, it's not enough to just have infrastructure. Now let's move on to have systems that allow us to be able to independently check and see which facility has available beds, which facility is available to grant a particular health service where the need arises. Because we don't want a situation where a health worker can simply say, oh, our place is full. By the time you investigate and find out, it will be surprising to know that there are actually spaces in the place. And we've seen situations where people are treated even on the corridors of the hospitals.
Council, not to cut you, you know one big problem I have? There are people who have been treated and not discharged because they are unable to pay. So all these people are occupying beds, but emergency cases are being rejected.
That's unfortunate. That's another unfortunate situation.
Indeed.
That's another very, very unfortunate situation. And what we expect to see that even if you discharge, the person must move from the ward at least, so that the beds will be made available for the next person to use them.
The system failure is just too
It's just too much. And you see, we talk about these things, we have committees set up, but sometimes the implementation and enforcement of some of the recommendations become a challenge. This is a clear situation where we all would reach out to the health minister and the persons who are managing our health sector to consider a system, an independent system that allows us to know where what beds are available, which hospital has facilities available at what point in time, what particular specialist services can be granted or offered in particular hospitals. See, we have hospitals and facilities all across Accra. I mean, from Lekma, come to Rich Hospital, come to University of Ghana Medical School, come to Police Hospital, go to Kolebu, and then we have polyclinics dotted all around. But quickly, let me just point out, one great disservice that the NPP administration also did to us is the La General Hospital. La General Hospital in its bar state was a functional hospital. Pulled it down.
But was it not posing a threat?
What threat?
The fiscal structure itself.
My own child goes to that hospital. So I've been to that place several times.
It wasn't a death trap.
It wasn't a death trap in any case. Let me tell you.
Because that was the argument.
Why?
No, it wasn't.
Come on. It was infrastructure. It was operational. It was an operational hospital. This is the same hospital that.
No.
This is
dishonesty.
It wasn't a death trap.
And then Mazi are you saying that? Are you on
let me finish. And we pulled it down for close to 2 years, 3 years. Nothing happened. I mean, we have situations where we announced to the whole country that we are going to construct 111 hospitals across the country, and gave even a timeline to do it. And yes, we failed to do so. I mean, sometimes, if it is established that it's lack of infrastructure, which is the cause of some of these things, then we are doing a disservice to ourselves because we earmark some of this project and we expect that it should happen. Now, let's move on. We have some infrastructure. Let's see how we can integrate this infrastructure into a system that would allow us to be able to tell that, oh, Kolebu has 2 available beds in the VIP. They have 2 available beds at the this emergency unit at that point, 37 has this, 37 had that, so that we can speak among ourselves. We can check from a system without necessarily having to rely on a nurse or a security officer or somebody at the hospital to tell you that, no, the place is full, we don't have beds. Even in the circumstance where we have some situation like what we experienced with this young man, I would expect that at least they would have found a way to stabilize the young man.
Before we got here, we used to say that, oh, why were people being carried in taxis and trolleys and all those things?
Exactly.
So then we came out with the ambulance system.
Exactly.
Now the ambulance picks the person, takes the person to the hospital, and then they tell you that, oh, there are no beds.
There are no beds. And even the ambulance, see how we came by this ambulance service, thanks to President Kufuor.
Yeah.
When we had the May 9th problem at the stadium, and we realized that truly we have lack of ambulance system. So that initiated the process for the setting up of the National Ambulance Service. And we have seen an improvement over time, of course. And I'll give credit to Leonardo for also increasing the fleet over the time. This one, you applaud me.
You see, you dug a hole and you are struggling to come out. Because one of the secondary...
So what I want to drive at here is that we need to bring in systems.
Yeah, true.
We have done well with some level of infrastructure. Now let's bring in systems that would help to improve health delivery. See, the challenge with health delivery, most people don't understand, is that it can be any of us at any day, any time.
Of course.
I mean, see what happened to our own senior man, PV Obin. It was an ordinary person at the filling station who assisted him and took him to the hospital.
To Lekma.
To Lekma. So imagine Lekma had turned him out, that they are turned him down, that they are unable to provide service because they don't have enough beds. Imagine what could have happened. Any of us could find ourselves in that situation. So I think that over the time, we have to also, whilst we build the structures, let's build systems. And let's also train our health workers to show empathy, to at least extend. See, the person you are turning away could be your father, your mother, your sister, or your colleague, or even yourself. At least this is your fellow Ghanaian, this is a human being. Show some concern. Provide first aid, stabilize the person, and then start looking around for possible places that the person can be. I mean, we have seen situations where people are treated in wheelchairs, people are treated in even sitting on ordinary beds, or even on benches. The most important thing is to provide the first basic care,
which is very
stabilize that person, and then you proceed to find permanent solutions to the person's injury.
This one they waited. Then when the guy died, then a certain doctor in Kuma came from the hospital and said, I will take him to the mortuary.
Can you imagine?
For there's bed.
Yeah,
the mortuary there's space.
When you die, they don't need bed.
That's very unfortunate.
Can you imagine?
It's just sad.
Yeah.
But the last part I want to draw attention to is the issue of HEFRA and other institutions wanting to investigate. I think this is the time for HEFRA to act. And I can count on the team at HEFRA to do a good job. I mean, they are responsible for regulating the health sector, health facilities. And I think the minister who supervises all this should perhaps allow them, and so that he'll be at the point of receiving the report. When he is deeply involved, sometimes the implementation and review becomes a challenge. But allow HEFRA to do a thorough work and then make recommendations. And we pray that these recommendations will not just be on the shelf and we talk as usual, and after the funeral and everything, we all forget about it until the next one happens again. Let's see some effort. We are lucky to have technology at our disposal now than we had 20 years ago. Young men are developing apps, are developing technology, and I won't be surprised that somebody will be willing to offer this even as free service to the Ghana government to help us develop a system that would integrate all the hospitals together and allow us to be able to. I mean, now you go to the hospital, they don't even use paper and pen.
Hold on. What you are saying was done by the previous government, trying to connect all teaching hospitals, all district hospitals. But what did you do?
Are you referring to LEMS?
Yes.
Lightwave?
Yes, because it is very important. You see, you can have a traumatic patient. You may not know that this particular person is allergic to drug A or B. So
once you have their medical records.
When you have their medical record, irrespective of the location, where the hospital is cited, you can enter the person's name,
details,
age, especially date of birth, and everything, blood group. In terms of this traumatic accident, hold on. Larry,
no, that is not where we are.
No,
where
Larry,
we are.
Larry, you can't do that.
Hold on 1 second. Let me
I am saying that.
You have to accept the person first before the records are shared.
Larry, I am saying secondarily, in going forward, government after government after government should seize the mantra that the government before me was as useless, and I'm changing course.
Because if there's genuine cause,
if you are stealing,
why not?
Hold on, Lamtiig.
The thing wasn't awarded properly. That is the issue.
Just last before
you see, remember that he took my time.
Would you agree that if there's cause for audit, if there's reason for cancellation, then we should go ahead with it?
It was a procurement,
I do not think so until
we should allow it.
No, listen. Was it providing the reason why it was implemented? Was it saving lives?
Was it value for money?
Absolutely. In my estimation, because I cannot put value over life.
I mean, thank God it is your estimation.
No, listen.
Let me wrap up. In a quick rebuttal to what you've just said, let me remind you again that system did not necessarily integrate available hospitals, available beds, and the systems together. It provided background information on the individual.
It was not necessary.
Let me finish.
Let me finish it with that.
Let me finish.
Take
your time and appreciate this. Take your time and appreciate this.
Let counsel land.
It is only important that when you admit the patient, you take the medical history. That is when you can know whether there's a background history or some other information from another hospital. See, that system, and I keep saying every day, any time that any government find good reason to review any policy or any program, let's do it. Reviewing it helps to strengthen it, helps to make it better.
True.
It doesn't mean that we should just allow things to go the way they are. But we are now calling for an integrated system that allows the hospitals to have a central system. The health facilities have a central system where we can tell that this hospital has 2 beds available, this hospital has 3 beds available, 2 people have checked out, 2 people have been discharged.
Exactly.
That way we can tell. It doesn't lie in the hands of a particular health worker to tell you that there's space or there's no space. That's what we are talking about.
I think that one we agree.
We also agree that there's a need to have what you are talking about.
Yeah.
But if there's a call for us to review it, why not? Let's do it.
Cancel it
When
without
the system is not working,
you find the alternative.
Let me